yogas or how to approach the Swasa Rogi or Kasa Rogi or the persons with respiratory allergy or persons with respiratory infections in Ayurveda. That is the today's focus theme, the theme of today's focus. And now let us come to the topic. Yeah. So my topic, my today's paper consists of just an introduction regarding the respiratory disorders as well as their samprapti and classification. Definitely, it is not a theoretical perspective. How a practitioner and how the classification should be based on how the classification to be done based on practical aspects. A practitioner, how to approach the Swasa Rogas by a practitioner. That's what the main area of my focus, and some of the critical analysis of some of the common yogas in respiratory tract allergy as well as this infection, then some of the rasa yogas if needed, and then conclusion. So the introduction, as the introduction part, usually the best thing is the first thing what we have to, not only in the case of respiratory disorders, in the management of all the disease or the systemic diseases, that we have to be very careful regarding three aspects. The first one is the precise diagnosis as well as precise the selection of the medicines. The second one is the typical understanding or critical understanding of the red flags or warning signs. That means we should be very thorough regarding when we have to regarding the point when we have to refer the patient, when we have to admit the patient, when we have to do the shamana therapies for the patient, when we have to do the shodhana therapies of the patient. Especially, we should be very much thorough regarding the red flags exhibited by the red flag symptoms exhibited by the patient. And finally, we should reduce our prescription, the number of medicines as much as possible. So how to reduce the number of medicines? Definitely, we can simply cut off the medicines by from 5 or 6 to 2 or 3, but that is not the matter. So we have to be for reducing the number of the medicines. What we have to do is first we should be thorough regarding the diagnosis. If we could diagnose the disease properly, then there is no need of selection of much medicines. That means beating around. We can avoid the term that is beating around the bush. With 1 or 2 medicines, we can get the exact result what we expect, or at the same time, we may get the little more the more result that we expect from the higher or with a more number of medicines. See, if we are mixing of so many medicines, there can be a drug to drug interaction. So we may not get the proper result what we expect. So always better to reduce the number of medicines as much as possible. Then only we can forecast the result. So for how we have to reduce the medicines, for that purpose, we should know thoroughly regarding the properties of each and every medicine. We should know where we have to give this medicine and where we have to give the other medicine, or we have to give where we should avoid such kind of medicines. So such matters we should be very thorough. For that purpose, we should analyze the nature of each and every yoga precisely or critically. So how to carry out that we will see now. We know these are the Swasaroga Nidanas. Everyone knows that. All of us have studied in the second year Nidana paper as well as the what we say the Kai Chikitsa paper. But I'm not going to the details of the theoretical part. Just whatever the things which we need to understand the further practical aspects, we need little bit theory part. So I'm explaining only that part. I'm just picking from that such topics from the Samhitas and making into the practically applicable form. So I'm not a theoretician actually. I'm not a teacher, and I'm a typical practitioner as well as a pharmacy person. I'm working as a consultant or as a senior physician in the quality control department as well as this research and development department. So always my focus is to not the theoretical part, but the practical as well as the manufacturing part. So, what are the permutations and combinations what we can make with our different kind of medicine that we will see. So we know that the nidana part, dhumopakhadat, rajasastadheva, vyayama rukshana nishevanacha, vimargagattvadapi bhojanasya, vegavarodhat kshavadhosyadasya. These are the nidanas what we have learned. Dhumopakhadat, rajasa tadheva, vyayama rukshana nishevanacha, vimargagattvadapi bhojanasya. So we will keep that part apart. Now comes the most important part of our treatment, the samprapti. That is pranagni udananugada pradishtha sambhinna kamsya swanatulya kosha. Pranahi udananugada pradishtha sambhinna kamsya swanatulya kosha. So the affected or the vitiated doshas are, it is definitely it is vata only, and precisely it is prana and udana. And when we come to the samprapti, Acharya clearly explained atha pradihato vayu. Atha pradihato vayu means what will be the condition. Atha pradihato vayu urdhvastroda samasrida udana rupamapanna. So what is the medicine? Oh, sorry, what is the dosha vitiated here? Which is atha adho vayu. Atha pradihato vayu urdhvastroda samasrida. The vayu which has been situated in the lower part of the body, which has blocked, and udana rupamapanna, which has attained the properties of udana. What is udana? Ud nayati. That is, ud nayati means nothing but which has got the property of moving upwards. What is apana? Up nayati. That is which goes move downwards. So here the apana vata is getting blocked with some other factors. Which are the factors that we will see? So with that the apana vata is getting blocked with some factors, and the natural flow or the natural movement of apana vata is being reversed, and udana rupamapanna, this apana vata gets the properties as well as the rupa, the symptoms, the lakshanas like udana vata, and then does the disease manifestation. So here this is the important one. The avarana of Vata. The first one is Nidana Sevana, that is Dhumopakatha, Rajasastadheva, Vyayama Rukshana Sevanacha. Such because of that Nidana. You see that Nidanas. Even though we know that the symptoms what we get during Kasa or Swasa is nothing but it's more or less similar to Kabhaja Roga, isn't it? A severe expectoration, otherwise severe chest discomfort, heaviness to the chest, etc. But still, see the nidanas. Everything, all the nidanas are Vada Prakopa nidanas only. Dhumopakada, Raja, Vyayama, Ruksha Anna Nishevana. Then again, Vimargagattvada Vibhojanasya. Everything are Vada Gopa nidanas. So here, the due to the vitiation of apana vata, and that because of the avarana of kapha or pitta, the apana vata is getting blocked with the other factors and getting the surupa of udana vata. Then and locates kantha and uras, urdhva srodha samasrada, then fills in the srodhas and produces kasa. This is the simple samprapti of kasa, and we can select the medicine only when we are thorough with this samprapti. How this samprapti can be made applicable to the practical aspect. Don't think that these are directly just simple theories only, but always this type of theory, the practice of Ayurveda is the foundation of Ayurveda is typically based on this type of theory only. So we will see how we can apply this theory to the practice field. And once the kasa is developed, definitely next kasa vruddhya bhave swasam purvairva dosha komare amadisara vamathu, like that it's continuous. So now we will see. So we will see the classification of kasa, isn't it? We know that pancha kasa, isn't it? So vata, pitta, kapha, kshayaja and kshadaja. But for treatment purpose, this much classification is not sufficient. We need to go in little more detail regarding uh, the classification part. Then only we can select the medicines precisely. So simple Vadiga Kasa, diagnosing simple Vadiga Kasa is not sufficient. Simple Paitiga Kasa is not sufficient to reduce the number of medicines. But how to reduce that? How to precisely, how to disintegrate the classifications little more precisely, that we will see. See, when we go to the practice field, when we go to the medicine field, we have to differentiate the treatment for definitely there are 5 types of kasa only: vata, pitta, kapha, kshata, and kshaya. But uh, simply diagnosing Vadiga Kasa is not sufficient to get the proper the result, because the line of treatment explained by Acharyas in Vadiga Kasa, which is occurring to the Vata Prakriti person, and the Vadiga Kasa occurring to the Pitta Kapha Prakriti person are entirely different. At the same time, the Paitika Kasa, simple Paitika Kasa is not sufficient, because the there are 2 types of other the Paitika Kasa is being again subdivided into 2. That is Paitika Kasa with Tanu Kapha and Paitika Kasa with Ghana Kapha. Here also the treatment is entirely different. Again, the next one is Kaphaja Kasa. When we go to Kaphaja Kasa, again there are 2 types. Kaphaja Kasa occurring to the Balavan, or Kaphaja Kasa occurring to the Durbala person. The treatment line is entirely different. How we can select the yogas according to these uh, precise classification, that we will see now. We will discuss as presenting complaint, as case by case we will discuss. So, shall we go to the first case? A male patient came to us with severe dry cough, with resonance, severe resonance since 1 week, associated with throat dryness, headache, and lethargy. These problems seem to be increased immediately after food and early morning around 3 to 4 a.m. His complaints were little bit reduced while sipping hot water, lime juice with sainthawa, or lime juice with salt and warm water. Again, at the same time, when we go to little more deeper, when we ask little more leading questions to the patient, he reveals the history of habitual constipation, irregular appetite, and disturbed sleep. Again, he has got severe inability to withstand cold climate, cold wind, etc. Whenever he exposed to cold climate or cold wind, the problems gets worse. So, what could be the diagnosis? Yeah, you can. I think we will make it an interactive session. You can post the uh, answers in the chat box. Can anyone? What type of kasa is this? Is it Vatika kasa, or Paitika kasa, or Kapacha kasa? Yeah, Vatika kasa, Vatika. Okay, okay, okay. Definitely. Oh, someone has no Paitika kasa. Okay, let it be, no problem. Vataja kasa, Vatika, Pittaja. So now we will see. It is typical Vatika kasa only. Yeah, Pittaja. So many answers, confusing. Actually, I am also got confused now. So there are, yeah. So the majority is for Vatika kasa. Definitely, we will fix on Vatika kasa itself. So, what type of Vatika kasa? That is the main thing. As I explained, the treatment explained by Acharyas for Vatika kasa, for Vatika kasa occurring to the, what we say, the previous one. There are 2 types of Vatika kasa, isn't it? I explained. So I will go to the previous slide. I am not able to change the slide. You can see this slide should be thorough with everyone's mind. Then only the further case we can explain. So Vadiga Kasa for Vata Prakriti person, Vadiga Kasa for Pitta Kapha Prakriti person. So please do concentrate on this slide. So now, by keeping that purview in the mind, now you think of this case. The leading factors are nothing but the symptoms are severe dry cough with resonance. Kupitam Vadalayarvadam Shushkora Kanthavakradam. Again, Krit Parshola Sirashola Mohak Shobha Swarakshaya. Now, these are the pointers to the diagnosis. That is nothing but Vadiga Kasa. And the other things are the confirmatory sign. Immediately after food, the problems seems to be increased immediately after food and early morning, around 3 to 4 a.m. Why that time? That is the main thing. That is the Vada predominant Kala, isn't it? Grishma Ahoratri Bhuktande Pragupyandi Samirana Snigdhamla Levanoshnescha Samam. So just we have to ask the patient to some of the leading questions. So which is the Vadiga Kada? That is very difficult to diagnose. But at the same time, if we ask to the patient, so do you get any disturbance regarding the during your sleep? Are you getting disturbed due to cough during sleep? Definitely he will explain, he will say, the patient will say that yes, I am getting the different the difficulties during at the time. Most of the time he says that when I get awake for passing urine at the time of maybe around 2 o'clock or 3 o'clock, severe irritation is there and see the cough is getting increased. So we will ask again, then how do you subside that? Whether it gets subside simply? No. He will say that no problem. Just when I drink some little bit warm water or water with salt, definitely the problems get subside. These are the pointers to the associated symptoms, the associated visheshana of dosha. Against Snigdha Amla Levanoshnescha Bhukta Pidei Prasamyati Grishma Aho Ratri Bhuktande Pragupyandi Samirana. So, and now this the diagnosis is Vadiga Kasa. Now the another thing is whether we have to diagnose whether he is a Vadiga Vada Prakriti person or Pitta Kapha Prakriti person, because the treatment is differ in Vada Prakriti as well as Pitta Prakriti person. So from the symptoms like habitual constipation, irregular appetite, and disturbed sleep, and Shita Sahishnudha, the inability to withstand cold and cold climates, points to the Vada Prakriti nature of the patient. So here we can diagnose the disease as Vadiga Kasa occurring to the Vada Prakriti person. Now we will go to the treatment. Again, Vadiga Kasa occurring to the Vada Prakriti person. So the Samprapti goes like this. Because of Vada Kopanitanas. What are the Vada Kopanitanas? Tiktoshana Kashayalpa, Ruksha Pramita Bhojani, Dharana, Udirana, Nisha, Jagara, Atucha Bhashanai, Priyadi Yogam, Bhi, Shogam, Chinda, Vyayama Garshani, Krishma Horatri Bhuktande, Pragupyandi Samir. Because of these type of nidanas, there is the increase of Vata in Koshta without Avarana. This is why I told that the first samprapti is very important. There are two types of sampraptis. One, the samprapti with avarana, and the another one is samprapti without avarana. So here, in case of typical Vadiga Kasa, absolutely there is no avarana. And thereby the treatment also differs from the other set. Here without avarana, because of the highly increased the apana vada or udana vada, so that gets moves upwards and locates over here without any obstruction, and that causes excessive dryness towards the chest as well as the larynx or whatever it may be, the entire respiratory tract produces kasam, and from this kasam it goes to swasam. Now, again, when we come to the treatment line, the treatment is Rukshasya Anilajam Kasam Adau Snehirupachari. Many a times we do mistakes. Even I also committed mistakes in the previously. Severe cough itself and the dry cough, even though it is severe dry cough itself, most of the time we give Elaganadi Kashaya or the Simulakatrayam Kashaya or Vyagradi Kashaya, like that. Definitely, such a prescription, we have a habit of giving this, what we say by default, Dasimulakatrayam or Intuganda, whatever may be the cough, whatever may be the kasa, or whatever may be the swasam, our first line of thought goes to this type of medicine, that is Dasimulakatrayam or Vyagradi or Intugandam or Balajiragadi, etc. But in this case, such an approach is entirely wrong because this is purely Vadiga, and there we should start with Rukshasya Anilajam Kasam. Vadiga Kasa occurring to a Ruksha person. That is nothing, Ruksha person is nothing but a Vada Prati person. So, Anilaja Kasa occurring to a Ruksha person should be treated with Adu Snehe Rupadire. We should start the treatment with the Sneha Prayoga. There is one apana or when the tree in the case in the when the context of Vata Vyadhi, there is one line called Tam Snigdhair Anulomaya. We have to do this anulomana, especially in this type of Vadiga conditions. We have to do this anulomana with the snigdha dravya. How to do the anulomana with the snigdha dravya? So mainly, we will discuss the properties of this and all these medicines in later. Now I will just demonstrate the set of medicines. So initially, in this case, if the Agni is proper and there is no other Ama Lakshanas, etc., we can directly go for the Snigdha Prayoga. What could be the Ama Lakshana, the Agni is proper? That how to do the how to understand whether if the patient is suitable for Snigdha Prayoga or Grita Prayoga or not. That we have to fetch from the Jurajagilsa. That is Kashaya Panapadhyana Dashahayridilinkita. Again, Vada Vittotere Jure. Kabhe Mande Vada Vittotere Jure. So if the condition is when the Kabha is reduced and the condition is Vada Pitta production, you have to go for this type of Snigdha Prayoga. That is, probably you can use three types of medical gradas. Usually I use in my practice. That is, one is Indugatam, the second one is Vidaryadi, and third one is Rasna Dasimula. And Arishtam, Abhayaristam as well as Viraristam. But there is one different difficulty in using Arishta. We don't use most probably this Abhayaristam, etc. are the most underestimated medicine. Abhayaristam is the wonderful medicine in Kasa. But the only thing is the person is Ruksha, the person is Vada Pradhana, the disease is also Vada Pradhana. Arishta is also Ruksha. Arishta is also Vada Provaga. So here, even though it is Anulomana, so we have to do the Snigdha Anulomana here. You can mix, the best method is you can mix this Arishta with the Grata. That need not be the medicated Gratas like Indugandam or Vidharya. The simple cow's ghee is sufficient. Usually I do in my practice like that, 20 ml of Abhyarishta with 2.5 gram or 2.5 ml of simple cow's ghee twice daily after food. Alone is sufficient for the Vadiga Kasa occurring to the Vada Pratipad. You can just try. Absolutely, there is no need of any other medicine. This is for sure. You can just try this Abhyarishta with any of the Grata after probably after food, and that alone will be sufficient. The same effect we can get through Jiragarishta also. Now let's go to the second. A male age 15 years. Again, simple dry cough with the resonance. Since 1 week, associated with the postnasal drip. The problems seems to be increased immediately after food. The symptoms are more or less similar after food and early morning around 3 to 4 a.m. The boy explains that definitely, yeah, I get increase of cough, or most of the time he explained as usually, yeah, I get awaken or get up at the time of 3 or at the time of 2 o'clock because of the increased cough. And the same thing, what do you do for reducing the symptoms? Definitely he say that I will just drink some of the warm water mixed with or salt or just simple lime juice, and gradually the problem reduces. Here, the difference lies is his bowel history is normal, but had a history of recurrent loose stools. His appetite was reduced since childhood. What could be the diagnosis? Symptoms, the chief complaints are similar to the previous one, but the associated complaints, previously he was suffering from habitual constipation, irregular bowel movements, or irregular abdominal distension, etc. But in this condition, the bowel history is normal. At the same time, he was suffering loose stools properly. So his appetite and with reduced appetite. What could be the again inability to withstand cold climate, cold wind, etc. What could be the diagnosis? Again, Vadiga Kasa only. Yeah. Vadiga Kasa. No, not Vada Paitika Kasa. Yes, no, it's not Pitta Kapha Prakriti. Yeah, exactly. Vadiga Kasa occurring to the Pitta Kapha Prakriti. Definitely. That is the typical diagnosis here. And the treatment here also is important. Previously, the simple dry cough, what I said is that comes Nigdhair and Long, Rukshasya Nilajam Kasam Madhu Snehe Ruvagre. That line is entirely wrong in this condition. Here, how to treat. Vadika Kasa occurring to the Kapha Prakriti person or Pitta Prakriti person, whatever it may. Here, previously it was Anulomanam, then Pajanam and Brahmanam. And here also Anulomanam at the same time Shamanam and Brahmanam. How to select the medicine? So we can select the medicine. Here we can adopt some of the Kashaya Yogas. Definitely, if it is a Vadiga Kasa occurring to the Vada Prakriti person, never goes to any of the Kashaya Prayogas. So here we can select the Kashayas such as Nayopayam, Balajiragadi or Induganta. There are some churnas, there are churna options here. Talisapatradi churna or Talisapatradi lehya. These two are the preferable medicines preferable medicines which I follow in my practice. How to differentiate these, that we will see later. Now we will see the third case. Again, male 30 years, presented with yellowish thread-like sputum since 1 month. He was feeling bitter taste in mouth, dysphagia, dysphonia. Excuse me. Hello. Huh? Yes, yes. Your class, your meeting. Sorry. So, yellowish thread-like sputum since 1 month. He was feeling bitter taste in mouth, dysphagia, and dysphonia. Previously, the problems increased at the time of 3 or 4, and now definitely he explained this. He gets awakened mostly at the time of midnight, probably 12 o'clock. In between 12 to 2, the problems increases and he used to get up. His cough seemed to be increased between or immediately after food intake. What could be the diagnosis? His bowel history is normal. He was suffering from chronic heartburn, belching, and sore throat. Sleep pattern was disturbed due to the heartburn. In between the sleep also, he gets severe heartburn and belching, and he gets to wake up. On auscultation, everything was normal, and absolutely the entire heart sounds, everything were normal, no other symptoms, systemic problems. What could be the diagnosis? Exactly, Pitta Jagasa with the Tanukapa. Very good. So you are picking up. Very good. Thank you. So Pitta Jagasa with the Tanukapa. Exactly. Pitta Pidakshikapada. Tikta Sitvam. If you ask to the patients, definitely word by word they will explain. Pitta Pidakshikapada. Tikta Sitvam. Joro Brahmam. Pittasrik Vamanam Trishna. Vaisuryam. Dhumago Amlagam. Burning sensation. Amlagam. This word belching. And when the problems increase, Sharan, Madhyana, Ratriartha, Vidahas Shamayeshu cha, the problems gets increased. The other problems will be the other. There will never be any associated complaints like constipation or abdominal discomfort, what is abdominal distension, etc. At the same time, you feel tikta seda, bitter taste in mouth, as well as this burning abdomen itself. Now, the treatment. Here, the diagnosis is Paithika Kasam with Tanukapam. And as per modern science, we can diagnose it as cough due to GERD, gastroesophageal reflux disease, which is termed as there is a typical correlation with the Paithia Kasa with Tanukapha with the modern medicine. What could be that? That is called as LPRD, that is laryngopharyngeal reflux disease. The problem occurring due to the excessive hyperacidity, and the upward moved bile or acid gastric content, it gets irritates the larynx as well as pharynx as well, especially the trachea, etc., and produces the kasa. That is known as laryngopharyngeal reflux disease, or what is the other the cough due to GERD. And what should be the line of treatment? Again, there are I will tell you the line later. Shamanam, Anulomanam, and Viryanam. Paithika Kasa with Tanukapha and Paithika Kasa with Ghanakapha. The treatment line is entirely different. That is Snigdha Sheedam Tanukaphe, Yuksha Sheedam Ghanakaphe, Karma Karya Param Bhojya, Snehe Lehe Sasyade. In case of Paithika Kasa with the Tanukapha, we should treat the medicine, the patient with the medicines with the properties like Snigdha and Sheedam. And in the case of Paithika Kasa with the Ghanakapha, the medicine should be Ruksha Sheedam. The line is similar, Shamanam, Anulomanam, and Virejanam only in both the conditions, but the properties of the medicines are different. Here, in the case of Paithika Kasa with Tanukapha, again we can use this Nayopayam, Guluchyadi, Drakshadi, or Pushkarerandadi. There is another very effective yoga called Pushkarerandadi. It is explained in the Gulma Chikitsa of Ashtanga. And probably there is a tablet called Acidact by Kotakila Ayurveda. That is made up of this yoga. Pushkara Erandadi is a very effective yoga in this type of condition. That is the only 4 medicines are there. Pushkara Erandayor Moolam, Yavam Dhanuyavasayam. Jalena Kudhitam Pidam, Koshtadaharujapa. You can see the indication, Koshtadaharujapa. See the ingredients. Pushkara Moola, Pushkara Eranda Moola, Yava, and Dhanuyasha. That is nothing but Dusparsa. Regarding churnas, avipatti, sitobaladi, etc., we can use this condition. And regarding this leha, vilyadi, we can use nayopayam and draksha. We will compare this yogas later. Now the 4th case. Male, 40 years, presented with complaints of severe cough with yellowish thick sputum since 1 month, associated with nausea, vomiting, and muscle cramps and fatigue. This problem seems to be increased at early morning around 4 to 5 a.m. His cough seemed to be increased between or immediately after food intake. Had a history of chronic smoking. On examination, on auscultation, mainly diffuse wheezes. We can see the severe wheezing with high-pitched continuous heart sounds. So what could be the diagnosis? Male, 40 years. The diagnostic part is severe cough with yellowish thick sputum since 1 month, associated with nausea and vomiting, muscle cramps and fatigue. Paithika Kasa with Ghanakapha. We can correlate this as acute bronchitis or the chronic bronchitis. See the symptoms. The only difference is nothing but the nature of sputum is one is thread-like and light, and in this case it is yellowish. And the increasing time, the precipitating time and the precipitating factors are more or less kapha predominant. That's why he explained the condition that he is getting increased at the time of early morning, at the time of kapha kala. The previous one it was Paithika kala, and this one it is Kabhaja kala. The problems get increased. You can just ask the patient; he will definitely answer that. Definitely at the time of awakening, at the time of 4 to 5 a.m. or 6 a.m. I'm getting at that. They may not say that at the time exactly, but still they will explain that when I am getting up from the bed, the problems get increased. Within half an hour, the problems get resolved. And when the what we say the sunlight comes, automatically the problems will be all right, and he will not feel any of the discomfort later. So here We can use the medicines as either Guluchadi Kashaya or Punarnavadi or Elakanadi comes here. The churnas like Chiriya Karpuradi or Valiya Karpuradi, there are two types of churnas. Avaleham, you can use Murdugadi Leha. Murdugadi, that I will explain later. Now, let us come to the fifth thing. A male presented with 40 years with complaints of severe cough with thick white sputum since 1 month, associated with nausea, vomiting, muscle cramps, and fatigue. He also explained, he will also tell that the same problem. When I am getting up, the problems gets increased. Within half an hour or within 1 hour, when I start my work, automatically the problem resolves. This is what he will be explaining. And at the same time, he say that I'm getting more discomfort here, and forcefully, when I do the forceful expiration, the problems gets cured. He can spit out a little bit thick sputum, and once that sputum has been passed out, again the problems will be cleared. What could be the diagnosis? On again here also on auscultation, you can get diffuse wheeze with the high pitch continuous sounds. What could be the diagnosis? Come on. Yeah, it is Kabajakasa only. But there are two types of Kabajakasa. Kabajakasa occurring to Durbala. Yes, exactly. Kabajakasa with that we see. So now that's good. Is Kabajakasa probably with Durbala condition. So here the treatment is, you see the conditions, the symptoms. Kabhat uro alparu moha stimidam guru Roma harsho ghana snigdha sweda sleshma pravartana. The nature of sputum he explained very clearly, and this is exactly similar, the same as the patient exhibits. Snigdha ghana sweda sleshma pravartana. Purvane purvaratrecha. Again, the increasing time is Purvahane, the early morning time, as well as Purvaratrecha. So the problem gets increased. And here the treatment is Vamana. Again, Pathya Bhojana. Here we have to use all the Ruksha Kriya with the dietary restrictions such as Yava. Because this is the actual Samprapti what we explained in the beginning. That is Udana Rupamapana Atha Pratihato Vayu Limbanurtha Samagata Udana Rupamapana. So that blockade, that obstruction of kapha of Apanavata, and which is getting transformed as Udanavata. And the Pathya Bhojana with the Acharya explained as Yavanam Vigridikshayam Kalashayam Chashile. So the Takra, Yava Vigridi, etc. are being explained here. What could be the significance of Yava? That we will see later. When we see the next yogas, we will see. Here, we can use the main ingredient, the yogas like Vyagradi Kashaya. There is one Kashaya which is called as Daru Nagaradi Kashaya, which is not available in market, but still it is explained in Sahasra Yoga Jwara Chikitsa. The indication is Mrityukalpam Jwaram Jaye. So it's more Ruksha, Tishna, and Dushna. Again, Deshamulam Kashaya, along with the Yava Churna as an Anubana you can use. Aragwadhadi or Valsagadi Ganam. Again, these are all explained in Kapaja Jwara. Aragwadhadi Sakshaudram, Valsagadir Jayajwara. He explained, Ajari explained in Kapaja Jwara. Aragwadhadi Gana or Valsagadi Gana with honey, with Mathu. Or Dashamulam Kashayam with Yava Churna as a Praksheva Dravya is very effective in this type of condition. Then Vyagradi Kashayam. When we come to the Churnas, either Panchakola Churna or Shadharana Churna. When we come to Agastya Rasayana, Avaleha, it is Agastya Rasayana is suitable only in this condition. That you should be very careful. Not all the conditions that Agastya Rasayana is suitable. Not all the conditions that Smolha Hridegi is suitable. Not all the conditions this Vyagriya Hridegi is suitable. Again, if you want to do the proper, again, if you want to go for the Vamanas, etc., you can use this Kantakari Grita as a Snehana Dravya for Snehapana. Now, Kabhajam and Kshayajam, Kshadajam and Kshayajam, we know that we need proper Shodhana therapy, we need to do the Pajana properly, then go to Snehana. Especially the Pajana can be better not to adopt the Kadu Pajana Dravya, because here also the vitiated doshas will be mostly the Pitta and Rekta. So always if we use much Ushna Dravyas for this Snehana or this Pajanas, etc., so there is a chance of increase of Vidagdha. The Pitta may turned as Vidagdha. So always better to use as Pajana with the Tikta Dravya. Pajana can be done with the three types of Dravya, with the Tikta Dravya, with the Kadu Dravya, with the Amla Dravya. So we have to do the all these Vajana Dravyas has to be differentiated or has to be given in different conditions. Not Panchakola cannot be given all the conditions can for Pajana. Shadharana is not suitable for all the conditions because these two are the Kadurasa Pradhana Dravya, and this should be given only when the Sama Kapha Lakshanas are exhibited. Then here usually the Kshatraja and Kshayaja, preferably of the vitiation of Pitta and Rekta. Here we have to go for Tiktarasa Padana, Padana with Tiktarasa. That is nothing but the Dravyas we can use is nothing but Pachanamritam Kashaya or Amrudotaram Kashaya. Sorry, Pachanamritam Kashaya, or even Amrudotaram can be substituted with the Pachanamritam, or even Guluchadi Kashaya, etc. We have to adopt in this condition. And either Sudarsana Vati or Sudarsana Churna or Mahasudarsana Vati, etc. is an option here. So this should be the line of the thing. Now we will come to the Swasa. The yogas we will explain later. So this Swasa we can mainly we have to think in the practical aspect we have to consider only two aspects. That is the Swasa produced due to allergic cause and Swasa produced due to non-allergic cause. So always this is what the better we have to think that whether which is allergic or non. First, our first preference should be, or first line of diagnosis should be the whether this swasa is allergic or whether this is due to any other reasons. So allergic cause is nothing but tamaga swasa. Simple tamaga swasa we can include. The only one possibility to be the allergic asthma is nothing but tamaga swasa. There are the other non-allergic cause, especially because of due to some of the brain damage or some of the other organ damage, even some of the kidney failure, etc., may lead to Swasroga. So such condition can be that is nothing but Shudra, Chinna, Mahan Swasa, and Urdhva Swasa. All the other four can be termed classified under the non-allergic form of Swasa. How that we will see now. Now we will see Tamaga Swasa. Tamaga Swasa, usually the patient with Tamaga Swasa exhibits two types of symptoms. There are two phases. One is early the bronchospastic phase, and the second one is what we say inflammatory phase. So in the broncho, how to diagnose these two? The treatment here also differs in both the conditions. Bronchospastic as well as inflammatory, the condition that line of treatment is different. So bronchospastic phase, there will be the difficulty in expiration, severe chest pain or chest discomfort, and there will be severe congestion. These are the the indicators of spastic phase. And in case of inflammatory phase, usually this is the secondary phase. The spasm continues, and there will be respiratory edema. That how to diagnose this respiratory edema and the airway obstruction. There will be severe wheezing as well as there will be the different what we say the broken type of wheezing pattern will be there. So if we meet a patient, if a patient comes with these symptoms, better we have to diagnose whether he is in a spastic phase and inflammatory phase. The line of treatment is different in both these conditions. That's all. So we know the Tamagaswasa we know very well. Have you there are now from this type of this much medicines you might have understand that there are different types of medicines explained different medicines which sufficient or which what we say reduces the different types of vitiated doshas in each and every condition. So but when we come to Tamagaswasa, Acharya doesn't explain any of the dosha vikalpas in Tamagaswasa, isn't it? There is no Vadiga Tamagaswasa or Paitika Tamagaswasa or Kabaja Tamagaswasa explained by Acharya. Then how to select the Vada Shamana Swasahara medicine or Pitta Shamana Swasahara medicine or Kapha Shamana Swasahara medicine? We have to tabulate the symptoms of Tamagaswasa into different kinds. Which are they? That we will see. individual dosha vikalpa of Tamakaswasa. We know the symptoms exhibited by Tamakaswasa are, that is Pradilomam, Siragachan, Udirya, Pavanakapam, Parigrihya, Sirogrivam, Ura, Parsuecha Pedayan, Kasam, Gurguraham, Moham, Arujim, Penasam Trisham, Karodi Tivravegamcha, Swasam Pranopadavina, Pradamye, Tasiyuktecha, Nishtudam Dekshanam Suki, Kritsat Sayana Susidi, Nishanna Swastamichi, Mekhambushida Pragwade, Slashmalay Chavivatane, Sayapis Tamagosa, Satya. This is the indicator. So how we have to differentiate all the symptoms into three groups. You know, Tamakaswasa patient will exhibit all these symptoms. So the symptoms exhibited by the patient, we have to classify, or we have to tabulate into different categories. How to get? See the Pradiromam Siragachan Udirya Pavana Kapam Parigrihya Sirograhana Uraparsha Grahana and severe Sharira Pida Arati. Sorry, Gurguram, Anubashayatu, Mekha Ambushida, Pragvada. These are the symptoms exhibited by Vada dosha. So, if a patient with wheezing, along with this type of symptoms, that we have to diagnose it as Vadiga Tamakaswasa, then only our treatment becomes proper. With the patient, if the patient exhibits severe wheezing, along with Trishna, severe intense episodes or excessive perspiration, we have to diagnose it as Paitiga Tamakaswasa. If the patient exhibits aruji, severe running nose, along wheezing along with the cough, again the Meghambushi, the Pragvade, we have to diagnose it as Kaphaja Tamakaswasa. Then only we can make that our treatment more precise and easy. So it is very difficult to diagnose, differentiate or to formulate, to develop a common protocol for Tamakaswasa. Many of the patients ask, or many of the students ask, sir, what is the treatment line of Tamakaswasa? So what I have to say is, sir, there is no definite line for Tamakaswasa. Tamakaswasa should be again disintegrated, or Tamakaswasa should be again differentiated, whether it is Vatiga, whether it is Vaitiga, or whether it is Kapaja. So now we will see the medicine. This is the allergic condition. Now let us go to the non-allergic. This is what I explained. The second one comes. The first one is nothing but precise diagnosis, and the second one is identification of red flags. The following, you should be very careful regarding the coming 3 or 4 slides. That, as per my opinion, if a person comes to you with this type of breathing patterns, you are not supposed to test the patient, because at any time the patient may go to collapse. So which are they that we see? There is one beyond respiration. You might have seen. The pattern is like this. It will be periodic breathing. Chinnat Swasidi Vichinna. Marmat Cheda Rujardida. Sasweda Murcha Sanaha. Vastidaharuja. Vastidaharuja. Adhodrup Vipludakshascha. Muhyan Rektegarojana. Shushkasya Pralabandhino. Nashtachayo Videna. So the second and third lines better not to go to much detail, but the pattern should be very, you should understand, you should observe the pattern of the chest, the movement of the chest. Even though if you are not able to auscultate properly, or if you are not aware to do the proper auscultation, you should observe, you should ask them to remove the clothes, and you should observe the movement of the chest properly. There will be Chinna Shosidi Vichinnam. He will just, the breathing pattern will be like this. He will do like this, and there will be a no wheezing zone for a short time. Again, he will start like this. Again, there will be a loss. Again, we will start. If you are happens to any patient exhibit to you, comes to you with this type of symptoms, where it may not be the Chinna Swasa, or it may not be beyond breathing. So, but you should be very careful regarding the diagnosis, and this could be due to the any of the injury of the pons, injury of the pons, injury of the any type of brain injury. It may be some of the tumors, it may be some of the what is the previous traumas, whatever it may be even the fits, the seizures, etc., also can cause injury to the pons. If any wheezing pattern are exhibited like this, you should refer the patient at least, or to the proper, either the neurologist, or the at least to a general physician, or else you should take an EEG definitely to identify the to exclude the possibility. Chinna Swasidi Vichinnam Marmat Cheda Rujardida. Then comes the another pattern, that is Usmaul's breathing. This is known as. We'll see the pattern. There will be deep inspiration like this. It will be both the expiration and inspiration will be deep, and there will be a no wheezing sound. Again, will be like this. Mahata mahata dino nadena swasadikratan udhuyamana sabrambho mattarshabhaivanisam. Severe mattarshabhaivanisam, like the what we say, the mad ox. So he will be just doing, he cannot sit, or he cannot lie down, or he cannot walk, whatever may be. He will be in such a condition that sarvasu avasthasuna sarmalapam, whatever may be the condition, he will not be able to, he will not get any type of relief. If a breathing patterns in your practice, if you come to do like this, definitely, and the patient will definitely, the term is called as air hunger. He will just do the forceful inspiration as well as forceful expiration. Such conditions, you have to think of any of the type of, there are different types of conditions, maybe diabetic ketoacidosis, it can be uremia, or it can be sepsis. A chronic diabetes, etc. If a breathing difficulty or wheezing occurring to a chronic diabetes, you should always suspect the ketoacidosis. Again, these are all a fatal condition that you need a ventilator support in this condition. So always be careful. Here also, you should undress the patient and you should observe the movement of the chest properly. Now you might have seen this Urdhva Swasa, and there is another condition called as apneustic breathing. Again, Udirkham Urdham Swasityurdham Naja Pratyaharatya. The Urdhva Swasa will be there, but the inspiration will not be there. And there will be the pattern will be like this. Again, there will be a forced inspiration. There will be a blank area. Again, there will be the same pattern will be repeated. This also, you can see the what we say, the breathing difficulty, especially in case of stroke, etc. You can just observe. Definitely, all of us, all the Ayurvedic physicians might have seen at least one or two stroke patients. So you just think, you just examine from your next day. You just examine your the patient's chest, especially in the stroke patient. Their respiratory pattern is a bit different. It will be like this. There will be a blank area, will be like this, and again there will be a blank area. So always, if you come to this type of conditions are increased too much, that also is alarm. In stroke, etc., there can be it's a normal line, their breathing pattern itself like this. But if the condition is more severe, then you have to refer to a patient where you have to get a ventilator support. So the first two, especially the allergic condition, the allergic asthma we can treat properly, and the other conditions we may be able to treat, but still you should be aware of such type of presentation. Now let us focus on the yogas. We will see the Kashaya yogas now, isn't it? Some of the Kashaya, the common Kashaya yogas we will explain. Here I included Vyaghryati Kashaya, Dashmula Kadatrayam Kashaya, Nayopayam Kashaya, Balajiragati Kashaya, Ela Ganati into Kanta. I am explaining this in comparison. So, Vyaghryati Kashaya. This Kashaya is explained in Jwara Chikitsa of Ashtanga Yoga. Vyaghri Shunthi Amradakvata, Pippali Churna Samyuta, Vada Sleshma Jwara Kasa, Swasa Penasa Sula. Vada Sleshma Jwara Kasa, Swasa Penasa Sula. So, indications are Vada Kapha Jwara, Swasa, Kasa, Penasa, Shula. This Shula, it can be either Parsha Shula, or it can be Amaja Shula, or it can be Kabhaja Shula. The site of action of this yoga is nothing but Amasya as well as Turas. The properties are Ushna. This yoga is Ushna, Tishna, Sroto Shodhana, Deepana, and Vatakapashamana. This yoga has got more action on either Pranava Srodhas as well as Annava Srodhas. So have you seen this one thing? One interesting factor. Vyaghri, Shunti, Amrita. 3 ingredients. Vyaghri, Shunti, and Amrita. And Pippali as a Churna, as a Prakshepa Dravya. Why Acharya included this Pippali as a Prakshepa Dravya? Why he didn't do this as an ingredient itself? That is the main thing. That points or that factor points to the nature of the yoga. Why can't he include this also? Instead of 3 drugs, why can't he include Vyagri, Shundi, Amrita plus Pippali as a Kashaya? in the Kashaya itself. There is a great logic that is this yoga, the indication of this yoga is nothing but Jara. The next stanza explained as Ushma Pittadride Nasti, Joro Natyushmana Vina, Tasmat Pitta Viruddhani, Tejet Pittadhiyerya. As Jara is a Pitta Pradhana Vyati, especially in case of Vaitiga Jaras, you have to avoid all the Ushna Tishna Prayogas. That could be the reason for this this Pippali Churna. Here, the Acharya needs the Pippali Churna, the properties of the Pippali, that Ushna, Tishna, etc. properties that is needed here to break the Avarana of the yoga, to Avarana of the Kapha. But that should not provoke Pitta also. For that purpose, as a Praksheva Dravya, that is in the small quantity, Acharya explained, Acharya asked to include this Pippali as a Praksheva Dravya. So Vyagri Shundhya Mradakvata Pippali Churna. So these are the practical. Now, as I previously explained the common properties of the yoga. But now we have to see what type of presentation we can give this Vyagradi. Where we have to give this Vyagradi Kashaya. Where we have to give this Dasamula Karutrayan Kashaya. Where we have to give this Hindukantan Kashaya. Or when what symptoms are exhibited by the patient, you have to select this Vyagradi. That is the main thing that we have to know. We know, as I explained previously, this is Ushna, Tishna, and Vada Kapasamana, and this is Srodha Shodhana. So everything is correct only. But not only that, that is not something, that is theory part. We should understand the symptoms exhibited by this. When the patient exhibits these symptoms, you should select Vyagradi. When the patient exhibits these kind of symptoms, you should select Dasamula Karutrayan. So such a differentiation we will go through. In case of fever, what could be the fever should be if the patient exhibit mild fever, because Vata Kapha always Vata Kapha is a mild fever. Tapahani, it is explained. Tapahani Ruji Parvasidoru, Penis Sosana Kasa Vibanta. It is explained. So a mild temperature, the patient exhibits very mild temperature, but there is we can say that's a rise of temperature, not a fever. If the nature of cough is much productive, if the nature of cough is sputum is thick, severe whitish, patient may even complain as heaviness to the chest, but difficult to explain. In case of swasa, in case of breathing difficulty, if the patient exhibits the symptom as difficulty in expulsion of sputum, he say that there is some tightness of the chest, but I cannot spit it out. In case of shula, either it can be parsha shula, or it can be amaja shula, or kabaja shula. That is sadopahrillasavami guruttam, staimityaganavakapapraseka, like that. So in such conditions, you can, the best option is Vyagradi Kashaya. If a patient exhibit mild fever, productive cough, thick whitish cough with difficulty to expel, or the expulsion of much thick white sputum, the best option is Vyagradi Kashaya. Now we will go to the Dasamula Karutraye. Dasamula Karutraye Kashaye Savrushayireva Makshika Prabeda Swasana Anila Kasa Parsha Prishta Trigamurdha Rujasu Sampradesh. Almost Vyagradi and Dasamula Karutraya has got some similarities and some differences. What are they? That we will see. Here the yoga explained in Sahasra Yoga only. So here also the site of action is Amasya and Urus. The properties are Ushna, Deepana, Pachana, again Vata Kapasamana. Almost all similar to the Vyagradi only. But because of the presence of Dasamula, this Dasamula Karutraya has got an extra added property, that is Shobha. How to Shobha in the Urus? Not all the Shobha. This cannot be given in the Shobha, what we say, the pedal edema, or any other, what we say, the abdominal edema, etc. This Shobha typically refers to the edema related to chest, edema related to lung. That is, it can be either pneumothorax, or it can be pleurisy, or it can be pyothorax, or it can be hemothorax. Whatever it may be, whenever the patient suffers from is diagnosed as a pneumothorax, etc., that we need the Shobhara kind of medicine. That too, Shobhara with an action over the urus. There are other Shobhara medicines also, isn't it? There are Punarnavadi Kashaya is there, Sukumara Kashaya is there is one Ardhavilyam Kashaya is there are Bhuhatyadi Kashaya is there. These are all Shobhara medicines. But all these medicines have got actions on different systems. Brihatyadi can be given in the Shobha produced due to the renal pathology. Ardhavillam can be given in the symptom, the Shobha produced due to the abdominal pathology. Sukumaram can be given in Shobha produced due to the abdominal pathology. But in case of Dasamulakadutraya, the Shobha which is related to the chest, that is lung, the Swasaroga, we can use this Dasamulakadutraya as an option. Here also, as Vyagriyadi, we will see this Dasamulakadutraya, where we have to give this Dasamulakadutraya precisely. If the type of intermittent fever, again Vata Kapachura, nature of cough, whether it is dry or scanty. If the patient exhibits nature of sputum as nil or scanty, or patient may complain as dry cough with the presence of very less sputum, but very difficult to explain. And another thing is exertional dyspnea. Then again, flank pain, especially the what we say, the pain produced due to the excessive strain during the cough, etc. The best option is desmolecularia. Now we will compare both of this, Vyagradi and desmolecularia. So, dosha samanatva, both Vyagriyadi and Desmulakatraya are Vatakapasavana. Vyagriyadi is Kabhadhiga Vatakapasavana and Desmulakatraya is Vatadhiga Vatakapasavana. That means the Kabha symptoms are more, Vada symptoms are less. You can just opt Vyagriyadi. And Vada symptoms are more, Kabha symptoms are less. You can select Desmulakatraya. Vyagriyadi and Desmulakatraya are equally Ushna. Tikshna properties are more with Vyagriyadi. Srodoshodhana is more with Vyagriyadi. Deepana Padana, both are Deepana Padana are more similar. Shobharatva, again, as I explained, Desmulakatraya is more Shobhara and Vyagriyadi doesn't have Shobhara property. Kaphanisaraga properties, comparing to Vyagriyadi has got more Kaphanisaragatva. That is expectorant properties more with Vyagriyadi comparing to Desmulakatraya. This is how we can compare both the sopas. Now we will see another condition, that is Nayobaya. Only 3 ingredients, Balajiraga Nagara. Reference is Chikilsa Manjari. Swasa Hitma Harampara. These are the ingredients. Swasa Hitma. Again, see the ingredient Bala, Jiraga and Nagara. Properties are Vataka Pasamanam, Pajana. Srodas is Pranava Srodas and Annava Srodas. Now, here, where we have to select this Nayobaya and Kashaya. Fever, there is no much action with the Nayobaya. Nature of cough. If the patient exhibits severe dry cough or very scanty of sputum. Again, nil or scanty of sputum. Again, dry cough with very like this Desmolakatraya. Again, this is very effective in case of exertional dyspnea as well as hiccup, severe type of hiccup. Then the main important area is GIT related. Bala, Jiraga and Nagara. Due to the presence of Jiraga and Nagara, the Nayopaya Kashaya has got a very extensive property, or it's very much effective in case of GIT disorders comparing to the Vyagriyadi or Desmolakatraya. So in conditions like aseptic disorder, abdominal distension, spasmodic abdominal pain, etc. This is very effective, and if the patient complains with dry cough along with abdominal distension, you can select this Nayobaya. Patient complaint, dry cough along with exertional dyspnea, you can select this Vyagriyadi, Nayobaya Kashaya. Again, the patient complains with loss of appetite and severe type of vomiting sensation. The best option, the wheezing with vomiting sensation or wheezing with the hiccup, the best option is nothing but Nayobaya. Now see the other medicine called Balajiragadi. Here also, Balajiragadi also, we can say this Balajiragadi as fortified Nayobaya. All the 3 ingredients are there in the 3 ingredients present in the Nayopayam is there with Balajiragadi also. Balajiraga Nagara. Again, here Balajiraga Villo, Pusta Vusha Vishchuradrumi, Guhekshu Laja Sahidaya. The yoga is mentioned in Sahasra Yoga, Swasa Kasa Haram. Here, which is the site of action is Udanavata and Vyanavata. The medicine is Ushna, Laku, Vada Samana, Deepana and Grahi. Always think here this Grahi is not the Grahi. Always we have a misconception of this Grahi. When we say this Grahi, most of us think that that cause constipation, but it is not. The term grahi is not a it's not the dravya which cause constipation. See, the deepanam, if a yoga is deepanam pajanam yattat ushnatva dravashoshadam grahi tatcha yatha shundi deepanam gajavippadi jeerakam gajavippadi. So if a dravya which has got a properties like deepana as well as pachana, and by its ushna nature, if it reduces the excessive jaliya bhava from the body, maybe extracellular fluid or whatever it may be, it can be termed as grahi. So always think, never think that grahi is not the medicine, no, not the group of medicine that cause constipation. Grahi can be given in many other conditions where you are suffering with the kleda predominant conditions. It can be given in postnasal drip, severe running nose, etc. The grahi medicines are very effective. So such thing, whenever there is kleda pradhana, you can select this grahi as a solution. Now here also, in the case of fever also, fever there is no much relation with fever, this yogas also. Again, like Nayopayam, dry or very sputum. The nature of sputum is also similar with Nayopayam. Exertional dyspnea, chronic asthma. And here also GIT, again as Nayopayam, this also is very effective in conditions like acid peptide disorder, abdominal distension, spasmodic abdominal pain. Now we will see difference. Nayopayam is, both are Vada Samana. But at the same, Nayopayam is Vada Samana with no, it is not Kaphavardhaka. This Balajiragadi also Vada Kapha Samana. Vadadhika Vada Kapha Samana. Nayopayam is simple Vada Samana. This is the difference between. Both are Ushna. Grahi property is more with Balajiragadi. Deepana Pajana properties are more with Balajiragadi comparing to Nayopayam. This Kapha Nisaragatva action is absolutely not there with the Nayopayam. So that you should be very careful regarding. If a patient exhibit with severe productive cough, with what we say the purulent cough, etc., if we select this Nayopayam or Balajiragadi, the result may not be satisfactory. So always you should think of this type of possibility. Now the other medicine, that is Ela Kanati. Ela Kana Madhuga Nagara Abdavasa Nimbamradambu Dashamula Sudakashayam. Again here comes this Dashamula. The Anubana as Laksha Sita Madhuga Jiraka Sampayukta. There are 4 types of Anubanas, that is Laksha, Sita, Madhuga and Jiraka. This Vaidiratnam Aushadha Shala produces this Lakshadi, this medicine, this Anubana as Lakshadi Churna. That is Laksha, Sita, Madhuga and Jiraka. Now when we come to the properties, it can be effective in occasional with mild fever. Acute exacerbation of chronic diseases like COPD. If the patient has a COPD patient, there can be acute exacerbation because of any of the type of Nidana Sevana. There can be an acute exacerbation. In such conditions, the other comparing to the other medicines, this Elaganadi is found to be more effective. If the nature of sputum is acute, the thick, purulent, and if the patient says that I am getting the relief once I spit the sputum. So this medicine here you can select this Elaganati. Again, exertional dyspnea, fatigue as well as lethargy. Anorexia, this aruji or abdominal distension or vomiting, GIT symptoms. Here also you can select this Elaganati. So always the thing is the Elaganati is more stronger comparing to Nayopayam and Balajiragadi, but less stronger, less Tikshna by comparing to Vyagradi and Yashmoladam. These are the common kashayas. Now we will see some of the avalehas as well as churnas. Within, I think we can finish within 15 minutes. So there are so many avalehas on the market. There is Agastya Rasayana, there is Pushmanda Rasayana, Mrityugadi Lehin, Talisavatradi Lehin, Drakshadi Lehin, then Vasishta Rasayana. These are some of the lehas which has got indication with the Kasa and Swasa. Where do we have to sell? Where do we have to give this Agastya Rasayana? Where we have to prescribe Mrityugadi Lehin? Where we have to prescribe Drakshadi Lehin? Where we have to prescribe Pushmanda Rasayana? That we will see. For that purpose, we will compare this Agastya Rasayanam and 2 similar yogas with almost similar ingredients. We will compare with Agastya Rasayana as well as Vasishta Rasayana. So the key ingredients of this Agastya Rasayana are nothing but Dashamulam, Swayangupta, Yasmula Swayam Hasti Vipalya Margam, Pipali Mulatipraka. And Yava Atakam. Yava becomes the key ingredient in the Agastya Rasayana. The other ingredients like Ghruta, Taila, and Guda are also presented here. The action of Dhadu is Rasa. Then the site of action is Amasya and Parshashula. Then the karma, the indications are, we know there are some interesting indications. That is that Vali Palidanasana, Panchakasa, Chayan, Swasam, Hitma, Gulmam, this Vali Palidam, etc. There are some of the other unexpected indications here. So here now we will see what are the why Acharya included this. See, there are some unexpected ingredients also, isn't it? Dasamula Soyangupta, Asti Vipalya Pamarga, Haridagi Sadam Seva, Yavanam Adhagam Sada, Haridagi and Yava. Why Yava included in this type of condition? In this, Yava came here as a main chief ingredient. What could be the reason? Why Acharya included Yava? And why Acharya included Dhrita, Taila, and Guda? So that is the common, when we understand that, this reason, we will find out the exact point, we will find out the exact nature of the yoga. So Yava is nothing but, we know the Ruksha Sido Guru Swada, Ruksha Sido Guru Swada, Saro with Vadagrit Yava. With Vadakrit Yava. Yava is Vata Vartana. And why Acharya explained a Vata Varthana Dravya in Agastya Rasayana, a yoga with a Vada, which has got a Viguna Gati of Vata. Nothing. You can see the Avarana. Here comes the importance of Avarana. Yavanam Vigriksharam, which I explained previously. That's why what we say, the Yava is nothing. Ruksha Sido Guru Swada Sarovit Vadagrit Yava. Here also, when we comes to the properties of this Yava, again the another indication is where we have to do this Yava. This then why we should be given this Abhaya. Swinna Sangrahini. Abhaya, we are adding this Abhaya as after this boiling with that. When we go to Bhava Prakasha, Acharya explained that Charvida Vardhayatekni, Peshida Malashodhani, Swinna Sangrahini. The Swinna Haridagi. In this condition, we are adding this Swinna Haridagi. Swinna Haridagi is Sangrahi. To prevent the Sangrahi nature of that, or the Grahitwa, Acharya added this Kripta. It's to balance the Grahi nature of Abhaya. Swinna Haridagi, Acharya added this Buddha as an antidote. Then Kabhavrde Yavanani Jangaran Magavakshino. Kabhavrda Vata. The best medicine is nothing but Yava. But at the same time, Yava is Vata Vardhana also. To compensate the Vata Vardhana Swabhava, Vata Vardhana character of Yava, Acharya added Taila and Krita here. So this could be the logic behind this, the inclusion of Abhaya, Yava, the unexpected ingredients like Abhaya, Yava, Buddha, and Taila Krita. So here also, where we have to give Agastya Rasayana. Better not to give this Agastya Rasayana as an initial step of medicine, because it needs proper Agni. This can be given as a Rasayana. Once the first line of treatment has been finished, that is first Samana line has been finished, or first Anulomana line has been finished, then we can give this Agastya Rasayana as a Rasayana therapy. Not Agastya Rasayana has got Rasayana. It's a Rasayana. It is not a Samana treatment. Definitely it is not a good option in case of acute exacerbations. And again, the best option in the conditions along with the respiratory conditions, along with the GIT symptoms, that is with the constipation, with what we say, the excessive abdominal distension, excessive burning sensation, etc. If the patient exhibit, the wheezing patient exhibit these kind of symptoms, the best option will be Agastya Rasayana. Now we will see the Mrudyugadi as well as Drakshadi Lega, which has got almost similar combination. Mrudyugadi, Mrudyuga, Pippali, and Sharkara. These are the main ingredients. In the case of Drakshadi, Draksha, Pippali, Sharkara, with Madhuka, Sundhi, Tugakshiri, and Dhatri Surasa. So again, as I told previously, fortified Nayopayam is Balaji Regadi. We can say as fortified Mrudyugadi is Draksha. The method of preparation is different. Mridugadi, what we have, it's not doing as a lehya paga. We are just pounding all the ingredients together and making into a lehya paga. At the same time, Drakshadi, we are doing as the preparation method is as a Navaleha. Sahapana is Madhu. Indication, typically Mridugadi is indicated in Paitiya Kasa. The textual indication is of Drakshadi is nothing but Halimagam, Pandu and Kamala, but there is no indication in Kasa and Shwasa. So, but by comparing, by considering the ingredients, we can see that the Drakshadi is equally effective in this type of respiratory pathologies also along with the other. So now we'll see the action of that. Mridugadi and Drakshadi are Pitta Kapsamana. Mridugadi is Kabhadika Pitta Kapsamana. At the same time, Drakshadi is Pittadhika Pitta Kapsamana. Both the medicines are equally effective in Prana, Rasa, and Raktavah sources. Mridugadi, Drakshadi is effective, more effective in Pranavah sources, Rasavah sources, and Raktavah sources. Because that's why the Acharya included this Grahani, Pandu, etc. as an indication. Mridugadi has got Chedana, Lekhana, and Kaphanisaraka property. At the same time, Drakshadi is more Shamana, Kaphanisaraka, Balya, and Rasayana. The Rasayana Swabhava is not there with the Mridugadi. Mridugadi is more of Shamana, as well as Drakshadi is more of Rasayana. These are the differences between them. So, now we will go to the first part. Mridugadi can be given in Paitiga Kasa with Ghanakapha, and Drakshadi can be given in Paitiga Kasa with the Tanukapha. Typically, as a spoon feeding, we can say that Paitiga Kasa with the Ghanakapha, Mridugadi. Blindly you can prescribe. Paitiga Kasa with the Tanukapha, Drakshadi. Just feed this. Now, Talisapatradi Vatakam, only one or two are there remaining. Talisapatradi Vatakam and Talisapatradi Lehi. Both are just one different. Both this medicine. That is, ingredients are Talisapatra, Chaviga, Marija, Tipali, Shunti. At the same time, in case of Talisapatradi Lehi, in place of Shunti is replaced with Abhaya. Abhaya Nagarasthani, Dadyada, Traja Vitrehi. So, but one is Vataka and the another is Leha. That is the main difference. The Anupana is explained as Madhya Yusha Rasa, Arishta, Mastu, Peya, and Paya. And Talisapatradi, in which kind of patients or which kind of symptoms we can give Talisapatradi Vataka, in which kind we can give Talisapatradi Leha. Typically, Vata Kabaja Kasa Swasa with normal wit Pravartana. If the bowel movements are normal, you can opt this Talisapatradi Vataka. At the same time, if the same kind of symptoms along with Graha as a symptom, if the patient exhibits constipation as a symptom, the best option will be Talisapatradi Leha. So always think Talisapatradi Vataka is not a universal medicine in Vasa and Shwasa. It has got specific indication. It is Vata Kapha only the patient with Vata Kapha predominant Kasa Shwasa, you give that too with normal wet Pravartana. Because it has got a tendency to reduce the excessive grahya jalamsha from the koshta, and that produces Vipran. At the same time, because of the replacement of Shunti with Abhaya, the Tarisapatradi Lehya becomes with Pravartana. This is the difference. So, both are Vata Kapashamana only. Talisapatradi Vataka is Vata Kapadika Vata Kapashamana, and Talisapatradi Lehya is Vatadika Vata Kapashamana. The Srodoshodhana properties are almost similar. Both the medicines are Pachana, Deepana, Kleda Shoshana, and Ruchya. At the same time, Talisapatradi Vataka is Grahi and Talisapatradi Lehya is Analogous. These are the differences. Now, the one Kushmandrasa. Nishkuligriti, we know that Nishkuligriti Kushmanda, Nichipedi Gunam Chive, like that it continues. The main ingredients are Kushmanda, Siddhaganda, etc. The medium is ghee only. It is Vata Kaphasamana because the indication is nothing but Shatajakasa. So action on Dhadu, which is Rasayana, Rasa, Rekta, and Mamsa and Medas. Site of action is Uras and Shaka. It is Brahmana as well as Rasayana. Indications are Kasa, Hitma, Jwara, Swasa, Rekta, Pitta, and Urasandhana. Urasandhanagara is nothing but Shataja and Trayajakasa. Urakshada. Urasandhanagara means nothing but Urakshada, that is Shatajakasa. So, Ushman Rasayana is the best option as a Rasayana in chronic condition. Again, as I told you, Rasayana, once the debilitating disorders, after the proper shamana therapies, you can select this Kushman Rasayana as a prasha or even as a Rasayana for a long time. Definitely, it is kapha vardhana in nature, and thereby you are not supposed to give it in the acute exacerbations. And it is the yoga is not pachana or kapha nisarga. It is purely of brahmana as well as rasa. Now, by comparing this, by analyzing this Haridra Khanda construct. So, the ingredients are Haridra, Triphala, Dhrita, and Kshira. It is also Pitta Kapha Shamana, and the yogas are it is that's good Pitta Kapha Shamana yoga. The site of action is nothing but Koshta. Karma means Visha. It has got what we say an extra indication, that is Vishahara, because the indications is Kotha, Sita, Pitta, and Udarta. But we all give this Haridra Ganda in respiratory in type of allergic reactions, isn't it? Especially in respiratory allergy than the other type of disease like this Chetapitta and Kotha. What is this Kotha and Chetapitta? Asamyak Vamano, the Kotha and Chetapitta are nothing, are almost Udarda and are almost similar. Chedapaniya Samsvarsat, Chedakale Visheshada, Saraga Kandu Shokam Syadurda Sakapotva. So the Haridraya Palanyashto, Shatpalam, Havishastata, this is explained. Sida Pitta Udarda Kothans, Saptaha Devanasi, the indication. So, how a medicine, Kotha is Kapha predominant, what we say Vada predominant. Sida Pitta is Pitta predominant. Udarda is Kapha predominant. How a single drug becomes effective in all the Vada, Pitta, and Kapha? Does it Tridosha Samana? I don't think so. But it's not Tridosha Samana, but it has got an action over all the doshas. How? All the it has got an effect or this Kotha, Sita, Pitta, and Udarta, because it is Vishahara in nature. So you can see these ingredients. You can just check the ingredients of this Haridra Ganda. Haridra Ganda is again, as I told, fortified Nayopaya is Balaji Ragadi, or fortified what we say the another one I told you. Sorry, I forgot. So we can say that the base of this Haridra Ganda is nothing but Avibhati Yoga. Almost similar yoga with the same kind of the Avibhati yogas along with the Avibhati yoga we know Vyosha, Trijadaga, Ambodha, Krimigna, Amalagay Trivat, Sarvai Sama, Samasita, Chaudrena Gurgi Yoga. Avibhatiriyam Nama Prasastapita Yoga. So this yogas, if we are adding Vibhidagi, Haridagi, Haridra, and Lohavasma, that yoga becomes Haridra Ganda. This is the difference. So Avibhati is the one which has the medicine which has got Vishahara properties. So this here also, this Haridra Ganda becomes effective in all this kind of medicine disease, that is Pitta predominant, Sita Pitta, Kapha predominant Udarda, and Vada predominant Kotha. It is not due to this dosha samanatva, but it is due to the prabhava like Vishahara. So this is what I have to say about that. I think I have compiled almost all the common popular yogas available in the market. So probably now in the next part is Rasa drugs. That I think we have got a detailed class of this Rasa with another one. So I'm not going to details. So let me conclude my presentation here that by saying that we need to evaluate each and every symptoms critically. Blindly, you are not supposed to give Dasamulakar Traya or Vyakhati. These are not the universal drugs. Talisapatradi Churna or Talisapatradi Vataga are not the universal drug in Kasa. Agastya Rasayana is not the universal drug in Kasa or Shwasa. These are the main things what we have. There are so many other yogas in our armamentarium. So always think over the indication and try to generate or try to understand the common properties of the yoga, and then you select the medicine. So if you do this, we can reduce the number of medicine, and thereby we can reduce the total cost of the treatment itself. Once again, I thank the organizer for giving me a chance. And if any doubts are there, I will be happy to clear that. If it is beyond my knowledge, I will